Hello, hi everyone. Welcome to the Beaumont Health Series. My name is Holly Weissman. I'm a Neurosurgery Nurse Practitioner at Beaumont Royal Oak. I am also the Assistant Director of the Beaumont Comprehensive Concussion Clinic at Beaumont Royal Oak.
And my name is Lori Sheridan. I am the Neuroscience Outreach Coordinator for Beaumont Hospital Royal Oak. And Holly and I work in tandem. Holly does the clinical component of our concussion program, and I do the community outreach piece. So we're going to start with Holly, who's going to go over the clinical sides.
So today we're here to talk about concussion management. First of all, a few objectives of our talk today, concussion objectives. Briefly, I'm going to mention what is a concussion, how are concussions treated, and then lastly, we will provide resources for treating concussions. So, the number one question most people ask is, what exactly is a concussion? The actual true definition from the CDC is that a concussion is a violent jarring or shaking that results in a disturbance of brain function. It is also considered a traumatic brain injury that may result in a bad headache or altered levels of alertness. And the other component of a concussion is that it will temporarily interfere with the way your brain works, can affect memory, judgment, reflexes, speech, balance, coordination, and sleep patterns. I have a video that I'd like to show you at this point. It's an animation of what happens when you have a concussion. This is from the cdc.gov website. As you see here, as the person's head is moving forward and backwards, the brain is actually shifting back and forth, causing the brain to hit up against the skull. A good way to think of this is a jar of pickles is an example I often use. If you think about it, the jar of the pickle here is the skull, okay? The pickles are your brain, and the pickle juice is your spinal fluid, because your brain floats in spinal fluid, and then you've got the skull protecting your brain. So when you have a concussion, when you have that violent jarring or shaking, as you can see how the pickles are going against the inside of the jar here, up against the glass? That's essentially what goes on in your brain. Your brain's hitting the skull back and forth, which then can end up with the concussion. Okay, so the word concussion actually comes from the Latin verb concutere, to shake violently. And the sudden movement can cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells, creating a chemical reaction, thereby in turn making your brain more sensitive to any increased stress or injury until your brain fully recovers from the concussion. Oftentimes, I tell patients when you have a concussion, it's similar to when you have a computer and you drop your computer and it's taking a long time to reboot. That's something that's similar that's going on in your brain. After a concussion, your brain has to slowly reboot, and you're thereby highly sensitive to the everyday stimuli that you could normally handle. One of the key things is a lot of people think in order to have a concussion you have to lose consciousness. That's not true at all. In fact, only 10% of concussions will actually involve a loss of consciousness. And coming up, I have a series of myths about concussions that I will go over as well. So another thing about concussion is that a CT scan and an MRI are most often normal. Concussion is invisible. You will not see a concussion on a CAT scan or MRI. The reason why we will order a CAT scan or MRI is if we're suspecting a skull fracture or an intracranial hemorrhage, which generally you'll have what we call the emergency red flag symptoms. thereby prompting a head CT scan. But in general, you will not see a concussion on a scan. A concussion is invisible. Unfortunately, approximately 15% of patients who have symptoms may last more than a year. Now I'm going to briefly talk about a second impact syndrome. This occurs when you have another concussion or a second concussion before you are fully recovered from a first concussion. And this is really something that we have to watch out for in our younger athletes, especially our children, our teenagers who are out there playing football. If they have a concussion, it's not recognized. They're not pulled out. They're trying to play through it. If they get another concussion, then they could have the second impact syndrome, which unfortunately can result in death, as it can cause rapid and fatal brain swelling. And the reason why, again, this is so important is the brains of the young athletes are still developing, making them particularly susceptible to a catastrophic injury if the brain is not healed before a second blow to the head. And again, this second impact syndrome is limited to the younger children, adolescents. It does not occur in the adult population. Excuse me. So, what can be a symptom of a concussion? A lot of people are unsure whether or not they have a concussion or not. And we have a list here of our symptoms. They can range from mild to severe. The list here includes an altered level of consciousness, confusion. Oftentimes patients will say, I feel like I'm in a fog, I'm just spacey. Headache, you may or may not even have a headache. There is a myth that you have to have a headache to have a concussion. Not true. Just by having an altered level of consciousness, not able to concentrate, feeling in a fog, in turn could mean that you have a concussion. Also, nausea, vomiting. Light sensitivity is actually a very common symptom of a concussion. We'll see people who can't tolerate being outside or just the daylight. They have to wear their sunglasses a lot. Then we've got dizziness or balance problems. It's a very common symptom from concussion. Memory loss, oftentimes people feel like they've lost time. And then again, an altered level of comprehension. They're not able to read and then remember what they just read. And then another key thing that often will happen is they're very anxious or very irritable. A lot of parents will come to our concussion clinic and describe their child as being not their usual self. They're just very irritable following a concussion. Now, the emergency concussion symptoms, these are the ones we really need to watch out for, and these are the symptoms that would prompt an emergency room visit and may or may not need a CAT scan. So if you've got a major change in your alertness or consciousness, they're not able to maintain wakefulness, they have a convulsion, they're weak on one side or both sides, a persistent confusion, you can't wake them up, repeated vomiting, that's the key here. If they vomited once and then they do it again, and then again, then you need to go to the emergency room and seek immediate attention. Unequal pupils or unusual eye movements, or they're unable to walk correctly. They're really off balance and falling or hitting the wall. So now I'm going to touch base on pediatric concussion. A lot of people don't realize the difference. There is a difference between pediatric concussion and adult concussion because children are different. They're developing. They're not just little adults. And when we manage concussion, there's lots of reasons we need to consider that how we treat concussions with pediatric patients. So the key things that we look at with pediatric concussion is their physiologic development, the impact forces, their ability to protect themselves, the effects on school and learning, their physical and cognitive recovery, and then finally the biggest concern is the potential for long-term effects from the concussion. So unfortunately, the young immature brain has decreased myelination and it's still developing rapidly through the early school ages. And the skull of children is thinner than the adults, and also their neck muscles aren't as strong, as adults, so they're more susceptible for concussions. The other thing with pediatric concussion in children is the impact force to produce a concussion is greater in children than adults, again, mostly because their cervical, their neck muscles aren't as strong and developed as adults are. Now the recovery, interestingly, the recovery from concussion in children generally occurs over sometimes a longer time period than adults, but roughly on average, a concussed high school athlete could take twice as long to recover than a college or professional athlete. So typically a high school athlete could take 10 to 14 days to fully recover, whereas a college or a professional athlete could only take 3 to 7 days. And sometimes the pre-adolescents could take even longer. But the key here is that we focus our efforts on getting these pediatric population to return to learn before they return to play. Oftentimes, these patients, just all they care about is getting back out there on the field, and they're not able to handle their schoolwork as they were before they had their concussions. So our key here is getting them to return to learn before they return to play. Okay, now I'm going to go through concussion myths. These are very common questions that I get all the time. The first one is, myth number 1, you shouldn't let your child sleep after a head injury. So this is kind of a wives' tale, if you will. Oftentimes, parents will tell me I woke them up every hour to check on them because that's what my grandma told me to do. And really the research has shown we need them to rest, and you don't want to keep waking them up every hour. That'll just cause more sleep disturbance and they're going to feel even worse. This may be true for an infant or a toddler who can't tell you what's going on, but we don't keep an older child or teenager awake all the time. In general, if you suspect a concussion, you want to have your child checked out by a physician or a healthcare provider who will advise you on the next steps, which will include plenty of rest. And I often say, just let them sleep. Okay, myth number 2. A lot of people are under the assumption, if I wear a helmet, I'm not going to get a concussion. Not true. Unfortunately, wearing a helmet, it's a good idea. Of course, we recommend that. But according to the American Academy of Pediatrics, there is not a specific brand of helmet or mouth guard that will result in fewer concussions, despite manufacturer claims. So don't believe any claims that you see. This helmet's better, it'll prevent you from getting a concussion. That's not true. The key with helmets is that it'll prevent you from having a catastrophic injury. It'll prevent a skull fracture, for example. Because again, the brain floats in fluid in the head like our pickles here, and a helmet can't prevent it from crashing around inside the skull, which in turn causes a concussion. Headgear is still important, once again, to protect against a catastrophic injury. Myth number 3, if your child didn't black out, he probably didn't have a concussion. So, only a small percentage of concussions will involve a loss of consciousness. In some cases, a child who's knocked out may suffer less injury than one who remains awake. Every concussion is completely different, so it's important to watch for all symptoms such as confusion, dizziness, headache, light sensitivity, etc. Myth number 5, vomiting is a sure sign of a concussion. While watching your child throw up is distressing, of course, but a single vomiting incident itself isn't a guarantee of a concussion. Some kids will vomit just simply because they're shocked or they're scared. It's continued vomiting, though, along with other symptoms such as confusion, dizziness, severe headache, that could indicate a more significant injury requiring immediate attention in the emergency department. Okay, myth number 6, boys get more concussions than girls do. So, believe it or not, overall the rates tend to be about the same, but the key here is the symptoms will vary between the sexes. Boys will report feeling confused, forgetful, having a headache. Girls, meanwhile, will describe more milder symptoms such as drowsiness or sensitivity to noise. So the other thing is comparing kids who participate in the same sports. For example, boys who play basketball versus girls who play basketball. Girls will have slightly higher concussion rates. The reason for this is unclear, but there are two theories, however, that state girls are more likely to report their symptoms, sooner than boys will, and also girls may have weaker neck muscles than boys, which may predispose them to more concussions. Okay, myth number 7. All concussions have the same clear-cut symptoms. So, unfortunately, each concussion could be completely different. Headache, confusion, amnesia are the most commonly reported symptoms, but there are many others, and no two concussions are alike. Symptoms can, be seemingly unrelated, but nonetheless, if you yourself or your child has sustained a blow to the head, or if, they were playing football and somebody sacked them and their head went back and forth, then they could have had a concussion. The key is to get them to a healthcare provider to determine whether or not they had a concussion. Myth number 8, often people are asking, can I get an MRI? Don't I need a CAT scan? So myth number 8, an MRI or CT scan can rule out a concussion. So neither of these tests will tell a concussion. Concussion is invisible. You can't see it on any imaging. These images will only pick up structural damage, meaning a skull fracture, or if you have intracranial bleeding. And again, if you have those injuries, such as the skull fracture or intracranial bleeding, you're going to have those more red flag emergent symptoms that I spoke about earlier. So again, best way to find out whether you or a child has a concussion is to seek medical attention, to be examined by somebody who's aware of concussion signs and symptoms. Myth number 9, only a blow to the head can cause a concussion. So, in reality, a knock to the head is usually a way a concussion occurs, but any severe jolt to the body can cause a concussion. So, for example, a bad whiplash in a car accident, just, putting your head back and forth in that movement could cause a concussion, where you rattle the brain and the skull, resulting in a concussion. Like I mentioned earlier, with football, just when these athletes are getting sacked by quarterbacks, they don't hit their head per se, but the heads going back and forth can end up with a concussion. Myth number 10, football is the most common cause of youth concussions. Believe it or not, no. Actually, biking is the leading cause of concussion in kids of all ages, whereas football is at the top of the list for organized sports for children 12 to 15 years of age. Wrestling and cheerleading, believe it or not, have the second and third highest concussion rates, according to Safe Kids Worldwide. Myth number 11, it's fine to return to school after a concussion. So, unfortunately, we do not want kids going back to school right away after a concussion. Going back to normal school activities too quickly can actually prolong your recovery. A brain with a concussion isn't functioning properly and can't handle the stimulation of being at school itself. Children with concussions may have trouble in the classroom, especially with their ability to recall what they've learned. They'll read something and they have no idea what they just read. So typically, kids with concussion will recover in about 3 weeks. So we help guide them through that process and take them out of school for a short period of time, return them back for half days, then return them back full days, and allow for accommodations so they're fully ready to go back to school when their concussion is healed. Myth number 12, this is interesting. Believe it or not, the myth here says dietary supplements can be used to treat concussion. That's absolutely false. Rest and time are the only proven remedies work to heal concussions. There's some claims out there, if you take the supplement, you're going to heal quicker. That's not true at all. There is no proven medication nor supplement that can heal a concussion. Rest and time are the key. So our concussion evaluation timeline, what we're going to do here is turn it over to Lori Sheridan, and she's going to talk about our program that we have at Beaumont.
Hi there. Okay, so we have an evaluation timeline where I, as part of the outreach, we go into the schools and we do baseline testing. This is done in coordination with athletic trainers that are in the schools, as well as just, myself or, my team going in and doing the screenings. So once that test has taken place, if there's an injury sustained through the season, then the athlete is removed from play and they need to go within the next 3 days for a follow-up evaluation with a physician or a healthcare provider who is trained in dealing with concussion. That might be your primary care doctor, and it might not. So you want to make sure that whoever you're seeing, they are well trained and versed in what the nuances of concussion and the treatment are. And then we would do follow-up testing, or your physician would do follow-up testing as needed to ensure that you are fully healed and ready to go back to play. So here are return to play guidelines that have been put out through Dr. Robert Cantu. He is from Boston Hospital in Massachusetts, and he's a neurosurgeon. Basically what he is saying is that if there is no loss of consciousness or the signs and symptoms clear in 30 minutes, you can return after 1 week if it's your first concussion. And then it goes on if it's your second concussion, 2 weeks, and you may want to terminate the season after your third concussion. As we look down, again, if there's loss of consciousness, then you would need to be off for a greater length of time. And when you have repeated concussions of 3 or more, then you would want to terminate your season and possibly look at not playing that sport any longer because, again, we're looking at the long-term health of your brain to make sure that, many years from now, that athlete's brain is functioning at the highest level. So concussion treatment, as Holly spoke of, it's cognitive and physical rest. This is really, the only treatment. If you need to take a leave of absence from school or work, or reduce your shortened day so that maybe you're going a half a day to school, make sure that you're, getting the proper rest. And getting enough sleep. We definitely do not want to see, students going to sleepovers or going to parties where there's a lot of stimulation, because all of this is going to stimulate the brain and, end up taking longer to recover from the concussion. I know a lot of students get upset about how much, time it's going to take them to make up their work. But what you really want to do is make sure that they're ready to go back to school full-time, symptom-free, so that they can do their best in school and on standardized testing. So while there is no evidence-based research regarding the use of medications, Holly and her team will at times tell someone if they have a bad headache, they can take an anti-inflammatory of naproxen, a low dose for a couple of days. But basically, the medication is not shown to heal or cure you of a concussion. So rest is really the best thing. So can a concussion be prevented? Well, basically no, they cannot be prevented. There's really no way, if you're playing an active impact sport, where we can guarantee that you're not going to have a concussion. But what you would want to do is, follow the rules. Make sure you're wearing your equipment properly. Listen to your coaches. They're well trained in your sport, and they're there to not only win the game, but keep you safe as well. That's their intention. And then again, does a helmet prevent a concussion? Holly went into that, quite extensively. It does not. But we still want you to wear a helmet if you're riding a bike or snowboarding or skiing or doing playing a sport that requires a helmet. The other thing is, keep yourself well hydrated. By keeping your brain well hydrated, it's similar to your joints and your body. It's going to sustain that injury a little bit better and maybe help you heal, more quickly. So again, make sure you're staying hydrated. Okay, so the concussion law within Michigan, that went into effect on June 30th, 2013, and we were the 39th state to actually enact the concussion law. We were a little slow, but we got there eventually, and basically what this says is that all youth athletic coaches and activity directors need to be trained in concussion. They need to understand what the signs and symptoms are of a concussion and when to remove the athlete from play. Also, they need to make sure that they are educating the parents and the youth in what the signs and symptoms of concussion are, and to know what their rules are in removing a student from play. And most importantly, the student, once they have suffered a concussion, they're pulled out of the sport, they must, it's mandated that they must have clearance from a physician in order to return to play. So, while, you may be upset with your coach or with the athletic trainer, you need to understand that this is the law, and they need to adhere it, not only, because it's the law, but also, their intent is to keep, students and young players healthy, just like we are. So the program that I take out into the community, it's called CHAMP. It's Concussion Health Awareness and Management Program. And while we've been doing a concussion program with baseline screening for the last 5 years, when we opened our concussion clinic a year and a half ago, Holly and I worked together to coordinate. So we then became the Beaumont CHAMP program. And what I do is I focus on the education as well as free baseline testing, which is actually we're able to provide through philanthropic funds as well as through funding through Children's Miracle Network. So young athletes are at the greatest risk for concussion. First off, concussion makes up 75% of all traumatic brain injuries. And for young people who are between the ages of 15 and 24, sports are the leading cause of traumatic brain injury behind only car accidents. So we know that kids are out there, they're playing sports, which is great, that's what we want them to do, but we also want to look at the data, which tells us 14% of student athletes will suffer a concussion at least once in their high school year, and 15% of all sports-related injuries that are reported to athletic trainers are concussion. So while you're throwing in your knee injuries, your elbow injuries, anything else, 15% of those are made up of concussion. So this is what really makes us stand up and pay attention. So the baseline screening really is the quickest and most effective way to evaluate whether or not a child has a difference in their cognition from baseline to post-injury. So what we do is we do the cognitive baseline testing in the school. It's done in a media center. We can test, many students at the same time. The whole program takes about an hour. We do a 10-minute educational piece, and then the student takes the online test. Cognitive testing alone will not diagnose a concussion, nor is this testing the substitute for medical evaluation and treatment. So remember that if you suspect your child or yourself of having a concussion, you want to make sure that you go to a qualified healthcare provider. So computerized neurocognitive testing is going to look at your verbal and visual memory as well as your processing speed and your reaction time. So it's going to take a basic snapshot of the function of your brain before you have an injury, and then after you've had the concussion, this helps your healthcare provider be able to not only see that there's a difference in your cognitive function, but also maybe understand maybe what part of your brain may be injured. So again, it helps healthcare professionals and educators make decisions about your return to play as well as your return to school and return to learn. So we use IMPACT. IMPACT is what we consider a gold standard in neurocognitive testing. It's not only a good baseline tool, but it also has the follow-up clinical component that really helps the healthcare providers that we have in our neuroscience concussion clinic follow that player and make sure that they're fully ready to go back to play. Impact is used by, a number of professional sports teams, as well as thousands of high schools and universities across the country. Our program is CHAMP, okay, so we start out with this preseason baseline impact testing with the education piece, and then we also have, if you suspect a concussion, then you would come in to see someone within 72 hours at our acute care concussion clinic. You would be seen by a certified neuroscience healthcare provider, and that would include the post-injury testing, and then from there they would come up with a treatment plan based on the individual's symptoms, and then return them to play as warranted when they are fully healed. If symptoms persist long-term, then the clinic personnel will actually triage them into, some follow-up care, whether that's occupational therapy, physical therapy, vestibular, craniosacral if you're having headaches. But we have a group of, healthcare providers that are well-trained in taking care of patients with concussion to do that follow-up care. Resources that we have our Beaumont Concussion Clinic. That again is staffed by neuroscience healthcare professionals who are trained in concussion. We do appointments on Mondays and Thursdays. And then if any time during the day or after hours, weekends, holidays, if you have a question, you can call that 855-4MY-HEAD phone number. If it's after hours, then we actually have trained nurses who can talk to you about the concussion and just give you some basic advice as to whether or not you should seek emergency medical treatment, or if you can wait and see a physician and follow up after the weekend or the holiday. Another resource is myself. I'm the one who sets up the education and baseline screening programs for new programs. My email is here, and you're welcome to email me, lori.sheridan@beaumont.org. And if there's any other information, we have our website, which has some substantial information about concussion as well as other neurological problems. And then, for further information about concussion, we really recommend you go to the CDC website. It's, that's where we pull a lot of our information from as far as statistics. It's, it might lag a little bit behind, but for the most part, it's really good information that should be helpful to you, whether you're a coach, whether you're the athlete, or whether you're a parent, worried about your child. So, this pretty much wraps up our program for today, the Beaumont Health Series. And again, thank you for having us.
It's been a pleasure.
Yes.
So once again, remember, we have the Beaumont Concussion Clinic as well as the CHAMP program. Please feel free to check out our website for further information. So thank you and have a great day.
Thank you.